When you get pregnant, and you're gonna have an abortion. You see the belly too old, that kill you. I had two abortions.
Really?
Yes, I had two abortions.
One in every four female between the age of say 15 to 45 will have an abortion.
In life, you're a human being and we have flaws. You have to do what you have to do. If you're not ready, you're not equipped and come, what can you do? I'm not saying it's right, because children are a blessing.
Yeah.
But if you can't afford a child, why would you have so much and can't afford it? Let blood come out, it will look like one little piece of flesh.
Yeah.
I think that's a baby.
In Office with Dr. Jervin Samuels.
Welcome to another episode of In Office. I am Dr. Jervin Samuels. In office with me today is a very special guest, Rosalie. Welcome to the show, Rosalie. Right? So Rosalie, as you all know, is a famous TikTok superstar. Superstar.
Yeah,
Soon, alright?
That many part TikTok.
Okay, alright. So today we'll be discussing general stuff about abortion because it's a medical channel and Rosalie here will give her views on abortion. But in general, let me introduce the topic. So I just want to give some statistics. I'm not going to go into details about the procedure in this podcast today, just about the medical, about the general public to be aware of the statistics and the prevalence of abortion. So based on the CDC data, it's saying that one in every four female between the age of say 15 to 45 will have an abortion. So it's a very common medical procedure that is done, right? And as we all know, in some countries, some states it may be illegal, and in some cases, some countries or some states may be legal. However, this normally does not normally prevent persons from getting an abortion, right? And if we're looking at the global figures, we'll see that approximately about 70 to 80 million abortions performed per year globally, right? And more than 90% of these abortions have nothing to do with any threat in terms of the life of the mother or any abnormality with the fetus or the embryo or any rape cases. Most of them are actually cases in which they, for some strange reason, such as mommy might feel that she can't afford another child, you're not ready for a child. Some persons may be in school, in college, and don't want to have a child because might jeopardize their studies. And in some cases, some persons cannot afford to have another child, etc. Right? But we know in the data about abortion countries, more than 50% of the population may agree with abortion. But for example, Christian group and males in general tend to be totally against abortion, right? But today we'll just have a discussion with Rosalie here and hear her take on abortion. Alright? Rosalie, welcome to In Office. Alright? So what's your take on abortion? Do you support it or you're against it?
Well, I had two abortions.
Really?
Yes, I had two abortions. For me, when I got pregnant, because I got pregnant with my first child in 2015, and I got pregnant with my second child in 2016.
Yes.
2015, 2016, and then I got pregnant around. Is that a 202 or 203? I couldn't carry it because at that time, that I had the other two, 2015, 2016, and it's close.
Yeah.
And I wasn't in the position to maintain so many kids.
Okay.
At that time.
Alright. But so what about you think we could have the option to give it up? What if it's you're real blessed in you're terminated?
Well,
what if that child is terminated that become the next Bob Marley, the next Usain Bolt, the next Vybz Kartel, or any great person in the world? What's the take on that? Have a feel a way about it?
sometimes I do think about it. Sometimes when I like a reflection, you know,
Yes.
and I remember me, I said, boy, if we live somewhere at that time, we have World Cup picnic and children are the blessings.
Yes.
We have to understand in life, we are human beings and we have flaws. You have to do what you have to do. If you're not ready, you're not equipped, and it come, what can you do? I'm not saying it's right, you know, because children are the blessing.
Yeah.
But if you can't afford a child, why would you have so much and can't afford it?
Alright, one next take is that like contraception is so readily available now in Jamaica for free, right? I know that different methods, have safe methods. I know that, for example, condoms are less safe methods, so we'd want to do methods such as like copper T, which they insert the copper T in the womb, or other types of devices in the womb. You have the Jadid, which is placed in the arm here. You have injections which you can get every 3 months. So I'm wondering that why would persons know that they don't want a child and still refuse to really take one of those contraceptive methods, which can be long term and reversible?
Well, those methods, for me, because I'm overweight,
Yes.
I couldn't get the one in the hand, which is the copper sleeve. Yes, the one in the hand, I couldn't get that because I was overweight. And the one which is a coil we insert inside of you.
Yes.
I have doctors told me that it's safe. I have people that female like I said will take it, tell me say it can shift and they still can get pregnant. However, the injection that they give you every 3 months,
Yes.
I took that and I can recommend it. It's not safe. You bleed, and when I stop having that mean when I say bleed, I mean your period will come. You will be seeing a period when it stops. 2 weeks, 3 weeks of spotting.
Okay.
It is not 100% safe. I was on it and I have to come off of it. The one that inserts in the womb, females told me that they were on it, and when they were on it, they got pregnant while they were on it. So that is not 100% safe.
Well, I understand, but still, if it's, for example, if it is 99% safe, I'm guessing that 100%, it would still prevent like a lot of these unwanted pregnancies. So it's still better to have that and practice other stuff like condoms and withdrawal than not to have any contraceptive method that is very reliable.
So why would you want to insert, alright, why would you want me on that and still getting pregnant?
No, it's not that common. Can tell her from that is actually a myth that
It's a myth.
Yeah, that it can be common. I'm not saying it cannot, you know, but it's not like it's 1 out of every 100 persons gonna get. It's not like 50% of the persons that have the thing is gonna get pregnant. Alright? Now, in terms of the abortion, like for example, like persons that are Christian and so forth, they're totally against abortion. So does that do you share your abortion story with anyone else before now?
Well, I've spoken about it
Several.
from time to time, but the things we talk about all the while.
Okay, so what are some of the comments and feedback that persons would normally tell you about? Because sometimes we think that females that have abortion, they're heartless and they're cruel, and some persons basically call them some murder or something. What's your take on that?
Well, I wouldn't say you are heartless and I wouldn't say you're cruel. I would have said as a female to a female, sometimes you get caught in a spot where you're gonna say, okay, I'm not ready for this. I cannot maintain this. I have no responsibility. I'm not living anywhere. I have no jobs. So, if you're not ready for something, why bring it on the world? You're not ready, but I guess.
Yeah, but as I was giving you an option, we can put the kids for adoption. And probably in the future, they're ready for them, they can put look back for them.
Nobody really wants to have the kids and need for adoption.
But it's inhumane to just be...
Child labor is very, very hard. Child labor is a life and death situation. when giving birth to a child, I've been in labor twice. It's a life and death situation. It's hard. So I would want to get pregnant, struggle through 9 months of pregnancy, about a 3 or 4 or 5 or 6 hours of hard labor, and then give away my child. I would leave my kids for an option.
Right? And so in terms of in Jamaica, it's illegal, right?
Yeah.
And so you think it should be legalized in Jamaica? Because then it's becoming, when it's illegal, what happens is that the females are now going to like some places that are not certified to carry out abortion or not to gynecology, so just go to random persons. Some persons who are giving them these pills, sometimes not even are doctors, sometimes just probably a pharmacy technician or whatever. They get the pill from and they just read up how to use it. Some start it at home and get in real complications. So what's your take on it in terms of, you think it should be legalized or should remain illegal?
I don't think it should legalize. I think it should remain illegal. Why?
Yeah.
Because if you legalize that, it's gonna mean that everybody will do careless activity at times will always want to go and do that. So the place will sell it will always be full. And remember, it's like you're taking a life. So why would I want to always take a life? So that means you're not going to protect yourself. You're just going to always have sex randomly, get pregnant, so you can abort it at a corner store down the road. No, I don't think it should be legalized.
All right. But it's contradicting what you said earlier, because you're saying that in your cases you had 2, and what if it was a case where you were gonna get like a life sentence in prison if you had an abortion and they found out? You'd have still go ahead and have the abortion?
Well, if it was a life sentence,
yes, for example, you're gonna get life in prison if they found out.
I wouldn't do it.
You wouldn't do it. Okay. All right. Now, in terms of abortion, right? You know several complications. So you mentioned that having a child is life and death, right? But I'm telling you that unsafe abortion practices is also life and death. So it's not that it's a very safe procedure, because now some of these persons that come even to my office that have been inquiring about abortion, sometimes when they go ahead and take the pill before they even come to the office, they don't do any ultrasound. And we know that sometimes if they get ectopic pregnancy, you might have other issues with the pregnancy, and they go ahead and take the pill without even an ultrasound, which sometimes they bleed a lot, sometimes they get infection, sometimes they even die. Because, you know, even here in Jamaica, news we hear about persons die from abortion. So, you have any reason to think that abortion is less deadly than having a child?
Well,
And we delivering birth?
well, you can be in child's birth. You told them it's tricky. But listen, when you get pregnant, you ain't gonna have an abortion. You see the belly too old, that kill you. That's what I like. You want the belly too old. The female and the child dash throw away the belly when the belly is too old.
Oh.
When baby form up already, it's a more higher risk than when it's a fetus, so it can just be easily bled out.
Okay. Alright, yeah, so for example, so we know normally have first, second, and third trimester, because a pregnancy is normally about 40 weeks, right? And the first 13 weeks there was in the first trimester. Normally about 90% of abortion normally take place in that first 3 months. That's what it means, right?
No, me tell me say them have girl with that shit, 8 months belly.
Yeah, I understand. But I'm saying that based on what statistics say, like about 90% or at least 80%, the figures may vary still, alright? Occur in the first trimester, that's first 13. But I'm saying that even those cases still can have complications, alright? So it's not necessarily...
The first 13 in
the first trimester, it can have, less likely. As I said before,
it's like it's fetus. Just mostly blood. And then you will see when the clot blood come out, it will look like one little piece of flesh.
Yeah.
I think that's a baby. That was
Yeah.
I've seen that.
Okay, so, but, in terms of sometimes, you know, that normally they say that guys are heartless, you know, because this can probably be a male against female debate here. They say guys are heartless, but sometimes I see like persons when they come and ask about abortion, they just say like, oh, doctor, can I get some pill or get something to wash it out or cleanse out or something. Sometimes it just make it sound like, oh, it's nothing, they just want like the washing out a plate or a cup, like they just want some soap to wash out a cup. That's how the female's mindset about abortion is now. Unbelievably.
Yeah, sometimes man greet woman and left them and look upon them. But I saw some of the young people that make it seems that I really don't have lack of understanding.
Yeah, so but in terms of like from in the past, like in old time days before we really know about like the structure of a baby, when they thought that like the baby was just a clump of cell and it would be equivalent to just removing a tooth or removing some tumor, I could understand. But in modern time when we know the data that a baby basically have a heartbeat and the limbs and the organs are formed within the first 8 weeks thereabout, it's kind of mind-boggling to know that a person would still just see having an abortion as nothing really, just a procedure that they just think that they're just having a menstrual period and do it. So those females are so heartless when it comes down to that.
I don't, as I said before, I don't think that, because I have done it, I've experienced, I don't think honestly, I'm gonna be honest, I don't think it's heartless. I think it's a choice they have to make. It's whether you're gonna stay with this, whether you're gonna have this child, or whether you're not gonna have this child.
Okay, it's a choice.
It's a choice. It's whether you're gonna have this child or you're not gonna have this child, because it's a made up mind thing. Some female like myself don't really want to do it, and some really do. But I'm just talking of experience of myself.
Yes.
Okay.
So that was other person that you know. What are some of the reasons that other person may have an abortion?
They don't want the child at the moment.
At the moment.
Mm-hmm.
Alright, because I've seen like, I mean, based on the data is that about 60% of abortion occur with women in their 20s, another 30% in their 30s, and in teens and above 40s, the rest, which are probably about 10% or less, right? But normally, I'm thinking that, initially before I checked the data, I thought that it would mainly be like teenagers who would be having the abortion, because by the time a female in their 20s, especially late 20s, what would be some of the reasons why I think they would not be ready for a child of that age?
At late 20s?
Yes.
I had my last abortion 2 years ago. I was around 3 years ago, 32, 30, 31. I was 29. And I had one when I was I think it's 30 and 28.
30 and 28?
Yeah.
And,
this I had to.
yeah, but, I still haven't gotten a contraceptive method. Like, no poverty, nothing at all.
No, I can't take the injection. The 5 year, some can't get because I'm overweight and
the copper T?
Yeah.
Let's say about the copper T.
Which one, the one going on?
No, the copper T is the one that they insert in the womb and they have no bleed.
No.
It's no hormones, they don't contribute to affect weight. But you're gonna run this stuff like you're gonna have another abortion if you don't use a contraceptive method. apart from just condom. No, but if you're still not on a contraceptive method, then you still run the risk of getting pregnant again, and it seems like you don't want to have any more children. Is that the case? You don't want to have any more?
Well, I'm going my mind about still going my mind about kids, but
yeah, but if it's a case where you're still going your mind, I think it's best when you put you have like a contraceptive method that is non-hormonal and it's not gonna really affect your weight or whatever. And
so that is the coil.
No, that is the copper T.
Oh.
So, yeah, they want to insert in the. So they didn't explain that one to you if you have these issues with the injection. Because normally my patients they come here and they having these side effects from different methods. They have to tell them the different options.
Let me explain that.
So next time you go to your gynecologist, you can just inquire about that. Alright? But in general, abortion is very common. We have several different, complications of it, including death. Alright? So it's not something that someone should just readily go.
It's not safe.
It's not safe. It's dangerous. So
I know it's not safe.
Alright. So, and it's way too, for something that can be deadly, it's way too common. Alright, because when I was reading these statistics, and normally I know that sometimes these statistics is likely underreported because it's occurring so frequent, illegally, and it's like, it's kind of hard to really tell if someone have an abortion or not unless you're either the doctor or the person facilitating it or the person themselves.
Exactly.
So if the data is showing like one in 4 in females in that age range, the reality is probably like about 2 out of 4. About 50% in that age range, alright? Alright, any final comments about abortion? Any take on it?
I had 2. My first one. When I did my first abortion, I went to the pharmacy and I bought some pills. I buy the pill. When I buy the pill, I got 6 pills. And I'd have to swallow, I think I swallowed 2 and insert 4.
Yeah. So where you got that instruction from to do that? You had gone to a doctor or you just read upon it and attend the pharmacy?
Who bought the stuff, the drugs from, told me what to do.
Oh, okay. The person was a doctor or just a salesman?
I can't say. I don't know.
Alright, that's good.
I was just in our last place and I had to get rid of it, and that's what I did.
Okay.
When I swallowed and I insert, I got capsule for the infection.
Okay.
I woke up in the morning and I was feeling a little bit crampy. The man said we can't take Panadol for the pain.
Okay.
When I went up the morning, I was feeling crampy. And then when I went to the bathroom, I just peed. And when I peed, I just felt like something running down my foot. And when I look at my foot, I was bleeding.
Okay.
And when I was bleeding, you wash yourself, you put on your sanitary and whatever and I went back into bed, and can I tell you, the pain was so unbearable. It was like having my son in 2017.
Okay.
It was very painful. So, that one, and then I did it again. Me don't know, me wouldn't recommend a girl to do abortion.
You would recommend it?
No.
Okay. You prefer it advise, even though you had 2 abortions?
No, recommend her for do not abortion. But if she asks me where I got it, I can tell her that I'm not honest. I'm going to recommend her to do it. But if she asks me where I got it, Because I got it twice, two different places.
Part of this program is that if they in case of any business or advertiser or they have social media that they want to talk about, this is your turn to go ahead and tell persons where they can follow you, whatever you're
Well, I'm on TikTok. So I'm on TikTok, Rosalie on TikTok. And if my dear friend Samuel send me the clips, I'll post it on TikTok and tell them where to find me.
Definitely.
Over on YouTube. So I will tell them that go follow Samuel over YouTube.
In office.
He's in office. And into my story about the tragical abortion.
Alright, so once again, Rosalie, thanks very much for taking the time out of the busy schedule to come in office to discuss this medical condition. And as I said before, many thanks for coming, because without persons willing to share their information, this channel would not be possible. So I'm really grateful for all those who have made it to this channel, alright? Until next time, be safe, and all the best in the TikTok and future endeavors, alright?
And no more abortions, not right.
Be sure to subscribe for more informative contents on life, sickness, and death.